Within just a span of few days, Delhi is looking at a slow rise in hospitalizations as well. The narrative that Omicron is mild is actually leading people to become complacent, and that is exactly what could be a problem for the healthcare system. I'll talk to Dr. Vivek Nangia, who's a senior medical practitioner here at the Max Healthcare. Sir, you've been working throughout in the COVID wards and you've seen the Delta wave as well. So, we are looking at a rise in hospitalizations now slowly, even as Omicron is showing rapid rise in cases.
Yeah, so that's a very valid point actually, that there's no scope of complacency. That is something that I'd like to say at the outset. The Omicron variant seems to be causing a mild ailment right now, but we don't know what the long-term consequences would be. What about the long COVID that we've experienced with Delta variant? Will that happen or not happen? And also that we need to remember that as of now, it is happening more to people who are in their 20s and 30s who have their good immune response anyway. So in them, you in any case expected a mild variant. And the results that have come from the Western countries where they've reported it as a mild disease, all of those places, the degree, the percentage of vaccination is very, very high. That is missing in our country. We still don't have as many people vaccinated doubly as we see in the Western world. So keeping all those things in mind, as of now, what we've been seeing is that yes, it is a milder disease. People are usually recovering in 3 to 5 days, maximum 7 days. In fact, turning negative also faster than they were with Delta variant. The usual symptoms are cough, sore throat, fever, body aches, and cold, stuffy nose. But at the same time, the hospitalizations are very, very minimal right now. Whatever hospitalizations we have, most of them are not due to the primary COVID related problems, but they were here because of some other medical ailment and incidentally have been detected to be positive. So the hospitalizations are not there. So we don't need to panic about the availability of beds in the hospitals. But definitely, if the numbers continue to rise as they are, when there's a steep rise and once the disease spreads into the immunocompromised people as well, like those who are elders, those who have underlying diabetes, hypertension, cardiac ailments, so once it starts to spread in them, then of course the hospitalization rates will also go up.
So, Doctor, in the last few days, when we are still at a comfortable level when it comes to hospital occupancy, have you seen people coming in for admissions into hospitalizations like it's happening on the Delhi Corona app? We have seen that number of beds that are reserved for COVID are also now going down slowly. The numbers not very drastic, but it's happening slowly.
Yeah, so admissions are very slow. As I said, there are very few people coming in for admissions. None of them are actually with a very severe disease. It's usually mild to moderate. And whatever admissions we have, majority of them are primarily because of they were here in the hospital for some other reason, like a stroke or a cardiac ailment or an arrhythmia or an abdominal pain, and were incidentally detected to be COVID positive. They are awaiting their COVID negative status before they can undergo the surgery or any other treatment that they have to.
So, if people are incidental positives, that's what you're trying to say, are they being shifted into COVID dedicated places that you have arranged?
Yeah, absolutely. They're then managed in the COVID dedicated area till they become COVID negative and can be taken up for the remaining procedure that they'd initially come for.
So, how are you expecting hospitalizations to increase? Because compared with the Delta wave right now, we have a large number of cases, really high spike in cases. But how soon do you see this translating into hospitalizations?
See, that is very difficult to predict because as of now, we are seeing that most of the patients can be managed on an OPD basis itself. They're not requiring to be hospitalized. Most patients are recovering in 5 to 7 days' time. Now, in how much time our hospitalization will go up or the utilization of the hospital beds will go up is difficult for me to predict, really.
So, when you say most are arriving in OPDs, the OPDs are getting overwhelmed at the moment?
Absolutely. So we are busy with the teleconsults now. And what I would say to everybody is that at the slightest incidence of fever, cough, sore throat, the first thing they should do is isolate themselves. Behave socially responsible, isolate themselves so that they don't spread their ailment to the others. Even if it is not COVID, it doesn't matter. Even if it turns out to be a simple cold flu, seasonal flu, it doesn't matter. Even that spreads sometimes. So it is better to stay in isolation and get themselves tested on the second or the third day.
And would you say people are preferring to stay in home isolation more than coming to hospitals at the moment?
Yeah, absolutely. Absolutely. In fact, what I would say is that the numbers would be much higher than what is being seen in our RT-PCR, because many people are just getting a rapid antigen test done at home and not going in for an RT-PCR. So the numbers would be significantly higher than what we are actually seeing.
So, message from Dr. Nangia is that one must continue to behave responsibly. Hospitals are right now looking at incidental positives, people who came for some other treatment but ended up becoming positive. So, that is also one reason that could lead to the stress on hospitals, but certainly not everybody needs to be admitted in a hospital and can be treated at home as well. With Ajay Thakur in New Delhi, Milan Sharma for India Today.